So here at St. George Dental Care, we see a lot of patients that are interested in doing cosmetic work, and they often are confused about the process and how that works and what they need, whether it's crowns or veneers. And this is all something that's on a case-by-case basis. So we invite you to come in and set up an appointment. We can consult with you. The way that we generally work up these cases, we like to start out by doing a wax up. So we kind of take, a full set of pictures, we take some impressions, and we just do our diagnostic work to try to find out what's going to work best, what is really needed. So here's a case, this patient, more so than wanting just the cosmetics, they actually had ground their teeth down quite a bit. This is a younger patient, and he ended up, wanting to have a change, obviously, to a smile, but also, we wanted to restore that function there. So on his case, we actually ended up doing a full arch of crowns in order to build up those back teeth. We were able to correct his bite and how they all fit together. And we're also able to open up enough space to where we didn't have to, take the teeth all the way down, because if you get a collapsed bite like that, you can't just add a crown and get full length. You end up having to open up the back teeth to get the full length there. So this is all things that we find out during our diagnostic wax up and our diagnostic phase, whether or not, veneers are going to be something that's justified or that we can get away with, or whether we're going to have to do something more extensive, like opening the bite and doing full arch restoration, which is what we did in this case. So Jen, who is our amazing lab technician, she does all of our cosmetic work in-house, and since we've been using her, we just have awesome, beautiful results, and they tend to work on our first go round. We're not having to send them back. If there's any minor tweaks that need to be made, which often they do, we can do those most of the time same day as we're delivering those crowns. But we do these wax ups, and we'll utilize this as the temporaries to kind of get an idea, hey, in the temporary state, what are these looking like in the mouth? How's the patient functioning? Is their speech normal? Do we need to make any tweaks? Do we need to change, one thing or the other? What about the shade? Are we happy with the shade? Do we want to go more natural look? Do we want to go brighter white? And so these are all things that can be done kind of as we're just approaching the case and as we're getting into it. As we start to have the day of procedure, the first day is generally where we'll prepare the teeth. We'll take all the copies that we need to send for the lab work, and we will put a set of temporaries in. So here's a case, this is actually the same exact case that we did the wax up on, where we had all this wear that was done, and we were able to get great natural looking results using porcelain crowns and opening his bite. And not only does it look great, but his function has improved immensely. It's been, I think, about 6 or 7 years since we did this case, and they still look as good as they did when we put them on.